Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us on the program today. Our guest is Dr. Michael Polydefkis. He's Director of Cutaneous Nerve Lab and Associate Professor of Neurology at Johns Hopkins. And he's joining us on the program today to talk about HTT or hATTR. And I'll let Dr. Polydefkis give us a little bit of background about himself and tell us all about hereditary ATTR. Welcome to the program, Doctor.
Thank you very much. So I'm a neurologist at Johns Hopkins. I'm a professor of neurology, and I focus on peripheral nerve disease. And over the past decade or so, I've become increasingly involved in this ultra-rare disease, hATTR. Mm-hmm. It affects 50 to 60,000 people worldwide, but it's probably an underestimate. We're probably missing cases.
So what is hATTR, or hereditary amyloidosis?
Yes, it stands for hereditary transthyretin mediated amyloidosis. And that's a mouthful, but this is a genetic disease. It's autosomal dominant, so it means that you have a 50-50 chance of inheriting the trait if one of your parents has it. And if you have the trait, you're at risk, but it's not a guarantee that you'll develop the disease. The disease is caused by this mutated protein, and the protein with time tends to misfold, and when it misfolds, it clumps, and the clumps accumulate in the heart, the nerves in the arms and legs, and also in the GI system. It typically starts in the 50s and 60s, so a little bit later in life. But once it starts, it has a steady, relentless progression. We typically see changes in patients, between visits every 6 months. Mm-hmm. When this protein clumps and deposits, if it deposits in the heart, people can develop heart failure or cardiomyopathy. So those symptoms will include shortness of breath. They get winded if they walk or go upstairs. They can become short of breath if they lie flat. Mm. If it deposits in the nerves, in the arms and legs, people experience numbness, tingling in the feet and hands, and with time, that includes weakness, and that ultimately can cause difficulty walking, can contribute to people being in a wheelchair. They have difficulty buttoning buttons, turning keys and doors, things that require a manual dexterity. And in the GI tract, it could cause this paradox of alternating constipation and diarrhea. So it's a systemic disease that can take quite a toll on patients and their families.
Now, you mentioned that it is hereditary and that you can get it from either parent. Does it affect males more than females or vice versa, or is it 50-50 across the board, since there is a 50-50 chance of you contracting the disease?
Yes, so it affects, but men tend to do a little bit worse than women, but both genders are affected.
So are these symptoms across the board wherever this disease happens to manifest?
So it's a good question. The symptoms in the early stages could be quite variable. So sometimes people experience pain in the feet, burning, stinging pain that's often mistook for a form of neuropathy that's much more common, diabetic neuropathy. Other people can have just numbness. Other people can develop weakness very early. So it can have a variable presentation, but the end result is usually similar in that patients develop weakness, numbness in the hands and feet.
Well, let's talk about Alnylam's the approved FDA approval of Onpattro. What is Onpattro, and how does it work to combat these symptoms?
So Onpattro is a game changer on many levels. This is a drug that's the first in its class. It's an RNA inhibitor, so it targets the molecule that gives rise to proteins, and in this instance, it targets the disease-causing mutant protein in hATTR. So the drug, in effect, is a laser-guided missile or weapon to target the protein's production, mostly in the liver. So the liver makes the vast majority of this protein. So Onpattro targets the liver and reduces the liver's production of this protein by about 85% on average. So if you're making less of the mutant protein, that leads to less misfolding and less amyloid accumulation, and that translates into less disability.
Does Onpattro have the potential to affect any healthy portions of the cell or in the cell's production as it eradicates the unwanted proteins?
Yes, so that's one of this approach's strengths. It's targeting not all protein synthesis, but it's specifically targeting the exact protein that causes disease. So it's very specific in that respect, and therefore it contributes to it being very well tolerated.
Well, where can our listeners go and learn some more about Onpattro online?
Well, certainly Alnylam's website has a lot of information about Onpattro. There are also several amyloidosis foundations that have detailed information about this drug and the result.
Well, I thank you for joining us on the program today, Dr. Michael Polydefkis, and giving us all this insight into the recently FDA-approved Onpattro. Thank you for joining us.
Sure, thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.